Welcome back guys, Dr. Shahid here, and in this video we'll go over everything you need to know about impressions, and we'll kick things off by reviewing one of the most widely used impression materials that you need to know about. That's right, irreversible hydrocolloid, better known as alginate. This material is easy to use, it's cheap, and it's reasonably accurate, but it's not dimensionally stable, which is why we have to pour it up right away, and it has bad tear strength. Now, as you guys know, when you mix alginate, you gotta be mindful of its setting time because you don't want the material to harden too quickly before you're able to place the impression tray into a patient's mouth. And warm water decreases the setting time even further, so make sure to use cold water in the mix if you anticipate having some issues with seating the tray. Lastly, once taken out of the mouth, alginate impressions should first be rinsed with water and then sprayed with hypochlorite for proper disinfection. On the other hand, we have PVS, polyvinyl siloxane, or VPS, vinyl polysiloxane as some people like to say. Same thing. This is an addition silicone, and because I don't want to bore you to death with the chemistry, just remember that addition silicones are much better than condensation silicones. They're dimensionally stable, they have high accuracy and detail reproduction, and they have excellent elastic recovery. Now, the most important factor to consider when selecting an impression for, say, a crown or a bridge is what's highlighted here, accuracy and detail reproduction. So it's no wonder PVS is so popular. Now, it isn't the only material that has high accuracy and detail reproduction, but its other properties certainly make it a standout material. It's not a perfect material though. For one, this stuff is super expensive, and its setting can be inhibited by sulfur compounds, such as the ones found in latex gloves or ferric sulfate, which is the active ingredient of astringent. The last takeaway for you guys is that since this material is often used for final impressions, which in turn produce master casts and the final restoration, you have to be critical of the impressions you make. That means if you spot a void, especially in critical areas such as the finish line, you have to remake the impression. Don't be lazy, be a quality dentist and make sure you get it right, even if it means you have to pack another cord. Wow, I'm too good with these segues. Alright, so we briefly talked about retraction cords in the previous video as a means of managing tissues, but they're so good at what they do that I gotta mention them here as well. Anytime you have a finish line that's below the free gingival margin, or even close to it, you gotta use retraction cords. Retraction cords displace the gingiva apically so that the finish line can be captured by the impression material. They prevent bleeding and the sulcular fluids from creeping onto the finish line, and they can be soaked in various medicaments. But always remember, you can't soak retraction cords in epinephrine for patients who have a history of cardiac disease. Alright guys, last thing I want to talk about is gypsum, which is the stuff used to make our models or casts. There are two different types of gypsum materials you should be familiar with, and they're dental plaster and dental stone. Dental plaster has a shorter setting time, higher expansion, and is less accurate compared to dental stone. It's mainly used to create diagnostic or orthodontic models or mount casts. Dental stone, on the other hand, is typically used to create working and master casts, although I personally like to use it to mount my cases as well, since it expands much less than dental plaster. Lastly, keep in mind that when you mix dental plaster or dental stone with more water, you'll increase the setting time and the porosity, but you'll decrease expansion and the strength of the material. So again, don't be lazy, measure out your water and make sure you're mixing just the right amount. Alright guys, it's that time. Let's reinforce everything we just learned with some practice problems. Question number 1. Which of the following materials is most appropriate for a fixed partial denture impression? Pause the video if you need some time, but the answer is C, vinyl polysiloxane. I try to trick you guys with the name here. This is just another name for polyvinyl siloxane or PVS. Vinyl polysiloxane is highly accurate and captures fine details, making it the ideal impression material for any fixed prosthodontic work. Alright, next question. What primarily determines the use of a retraction cord during a crown preparation procedure? Again, pause the video if you need some time, but the answer is A, position of the finish line. Retraction cords push the gingiva apically and outward to help expose the finish line, so their use is dependent on where the finish line is. So if we have a supragingival finish line far away from the free gingival margin, there's really no point in packing cord. Alright, last question. Which is the most appropriate next step given the clinical photograph? As always, pause the video if you need some time, but the answer is B, place a retraction cord and remake impression. So this question plays off the previous question very nicely, and the key to answering it is noticing that the finish line on the impression isn't super clear. We can see it at certain parts, but it kind of disappears here and there, likely due to the presence of gingival tissue. So the best course of action is to pack a cord and remake the impression. And with that, we're done. As always, here's a summary of some of the high yield points we went over in this video. Thanks for watching, and see you next time.